This is SOS Children's Villages Radio, and we're talking to the National Director of SOS Children's Villages Somalia, Mr. Mohammed. Would you be so kind, sir, to describe the current situation on the ground in Somalia?
Yes, of course. Current situation in Somalia remains very, very terrible. And it was just 20th of July, a few days ago, that the United Nations declared that famine exists in Somalia. Actually, not the whole country, but they identified that two regions in southern Somalia are facing a drought. And then they declared a famine in these two regions. And one of the regions is neighboring region of Mogadishu. Actually, it is next to the Mogadishu. And by declaring famine, the United Nations have identified some problems like acute malnutrition rate, which is 30%. But in our case, it has exceeded 30%. And in some places, actually, it was said that it is about 50%. And also another characteristic they use to declare famine is when two people, every 10,000 die per day. But according to the reports from UN, Somalia case has exceeded, and it was like 6 people dying every day, out of 10,000. And most of these people dying were children of under the age of 5 years. And also another characteristic they use is when people are not able to access food, shelter, and water, which in our case, we have already 1,000 to 1,300 people moving to the neighboring countries, that is Kenya and Ethiopia. And also, it is estimated in the last 3 months alone that 9,000 families moved into Mogadishu. So when you put together all this, you see the situation is terrible. The situation is very, very difficult for the people affected by the drought.
How has SOS Children's Villages been responding to the famine in Somalia?
Okay, SOS Children's Village has been in Somalia since 1985. Actually, it was 1985 when the first village was opened. And then after that, other affiliated projects have been established, like SOS Herman Minor School, primary and secondary, like SOS Kindergarten, which is in the village, like SOS Medical Center, and the SOS Vocational Training School. With the support of European Commission for Humanitarian Aid, which is called also ECHO, we have been assisting people by providing medical services about 170,000 beneficiaries every year. And the ECHO was funding this project more than 10 years. But now with this crisis, immediately SOS Somalia team did a rapid assessment of the drought-affected population in 3 locations. One is in Mogadishu. Another location is Baidawa, where we have a small medical center. And also we did a rapid assessment, the 3rd location, which is in the Lower Shabelle. Lower Shabelle region is the one of the region that UN declared famine. And after this rapid assessment, what we found is actually, can I say, so many priorities with many challenges, because even sometimes to prioritize the priority, it is very, very difficult, and it's becoming challenging. So what we found there is people who are lacking proper shelter. So you find a whole family of 5 or 4 or even 6 members are just sitting under the tree, or even those who are sitting under the tree are lucky enough. You find others who are sitting just on the ground. So that was one need we found there. After shelter, you also find people have no water. In this case, also, we are not talking about clean water, but at least something to drink. So you find a whole family of 6 persons sharing like a 3-liter smaller jerrycan. You also find health services who are very poor. All these 3 locations, we did the rapid assessment. There is no single health services, operational. So actually, we sat down and then we try to prioritize all these needs which people affected by drought are facing. And what we found is now we can maybe intervene by offering medical services because we have been running a huge medical facility in Mogadishu, and now we have also the expertise in doing this activity even in the IDP camps. So we discussed this issue with our medical director, the medical staff we have, and then we said let us be very quick and then set up a health post in one of the biggest IDP camp in Mogadishu. So right now, today is the third day that we are running that health post, which we opened 2 days ago, and actually we have been able to assist so far about 600 people, mainly children and women. So now the first intervention we have so far done is setting up that health post in the biggest camp, which accommodates about 5,000 to 6,000 families. The other interventions we are still discussing how best we can intervene, how best we can do. But right now, what I can tell you is we set up the first health post in that IDP camp.
And what are some of the challenges you're facing in getting aid to the population?
Okay, there is a common challenges like when you talk about the situation of Somalia, immediately one challenge is insecurity. But that one, at least we have been dealing with it in a way that we are able still, after all these years, to be there providing services to the community, running our CV in Mogadishu and all these things. So for us, insecurity, it is a challenge, but really we adapted, to deal with ever-changing situation in Mogadishu especially. But again, I can say also it is a challenge. Another challenge we are facing is the priorities. This was like a very drastic thing happened in Mogadishu because all over the sudden in 2 months' time we realized or we found that thousands of families are coming into Mogadishu. They have nothing. They are only able to carry their children or very few households. So the challenge now is you go to IDP camp and then you see the need there, and then now to prioritize even these needs, it is very, very difficult and very challenging. For example, how do you prioritize health when the person doesn't have even a shelter, when a child, is sleeping just on the ground like that, in this harsh, sometimes it's hot, sometimes it's rainy, sometimes it's even cold. So that is the big challenge. Another challenge we are facing is also coordination, because what is happening now is so many organizations are willing to help the people. So many even countries are sending team to assist how best they can help these affected people. But what is being lacked so far until even today is lack of coordination. So you don't know who is doing what and where. So you find some people dealing or prioritizing shelter, and the people are given these plastic sheets just to set up a small hut where they can hide themselves from the hot sun. But then who is doing the sanitation? Who is doing the food ration? Who is doing the health? Who is dealing with the nutrition? So it is not coordinated, all these activities, and also this is a big challenge. Yes, I'm afraid so many organizations may come in, so many countries may want to assist these people, but a lack of coordination will bring a big problem.
How are we working with other relief organizations?
And having been there in the last 20 years or even 21 years, SOS has been playing a big role in coordinating all our activities with our partners like a UN organization or European Commission for Humanitarian Aid and other international agencies. So we made sure that we have all this partnership or cooperation with other organizations. A good example now is, for example, European Commission for Humanitarian Aid requested us, to reduce our funds, which we want to implement activities for 12 months, but now we are being asked to reduce into 9 months, and whatever amount of money we saved from there, just to use for the immediate intervention. So, this is a good gesture. Another example is now the health post we set up in the IDP camp. It was built by Norwegian Refugee Council because they are an expert in setting up the camps and all this and all that. So they put up the tents. They immediately assist us water supply. They also facilitated building some pit latrines, just assisting us in the setup. So yes, actually, we have a partnership with other organizations, and our work relation is really good. I can say at this difficult time, it's really good.
What else should SOS Children's Villages and other relief organizations do at this point?
Yes, actually, the other relief organization, like UN organization, WFP, FAO, these big UN organizations, they are trying to intervene at a bigger level. For example, WFP is talking about feeding 3.2 million people who are in need of a food supply. So I think today they are starting airlifting some food items to Mogadishu. And UNICEF also, they are trying their level best to scale up in terms of supporting the children who are severely malnourished and all these things. But now coming back to our capacity and how we can intervene and help these people, as I said already, we have already set up a health post in one IDP camp in Mogadishu. We are also planning to have a health post in Baidawa and also another location called Kilometer 50. So we want to make sure that these three health posts are operational and helping people. Also, what we want to do is children under the age of 5 are severely affected by malnutrition. So what we want to do also is to open 2 outpatient therapeutic program, one in Mogadishu and one in Baidawa, where we can reach about 1,000 children each location who are severely malnourished. Yeah. Also, we are thinking about to scale up our stabilization center. Stabilization center is where the severely malnourished children with medical complications are admitted and both, fed properly, at the same time treat the medical complications they have. So also we want to scale it up. We have a capacity of 50 per month, but we need to scale it up and reach like 100 to 150 per month, children admitted in the center and then treated. Also, we are talking about or thinking about in terms of general food distribution for families affected by the drought. This is also another area which we need to have an intervention. So what we are thinking about is like giving out of food vouchers where families can get like once every month a packet of different items of food ration. So these now the areas we are thinking about. We can really play a big role and then assist the needy people.
What is the situation with regard to our SOS families and co-workers in Mogadishu?
Okay, they are all fine. They are doing well. Actually, our families, they are okay. Our children are okay. We just foresee that we may have a food shortage, but to avoid that, we stopped now food ration for our families in the next 4 months. And also our staff, they are fine because since they are getting the salary, still they are able to go to the market and buy food from there. So all these things happening have not affected so far our families and also our staff. So at the moment they are doing well.
Sir, thank you so much for this interview and thank you for being on SOS Children's Villages.